I enjoy how our medical school coursework is reflecting the change away from paternalism and into patient-centered care.
OT's help individuals get back to their daily functioning and to activities that are meaningful for them.
One interesting thing that people might not know about pharmacists is that we can apply for additional prescribing authority. This allows us to prescribe all Schedule I medications except for narcotics, benzos, and controlled drugs.
The scope of practice of pharmacy has greatly changed within the past decade. Beyond dispensing medications, we are actively involved in patient care, from conducting medication reviews to managing medication regimens.
I believe nurses are the patient's advocate.
Nurses utilize critical thinking every day.
I think nurses are coordinators of care.
And let's make one thing clear, we are not the doctor's handmaiden.
Hello, I'm calling from the surgical floor. I have a patient here that's been prescribed Maxaran, and it's supposed to run a normal saline. And I'm just wondering if that's okay. As well, they also have Lopressor and Dilaudid, so I'm just wondering if I can have all that going together.
Whoa, sorry, who am I talking to?
It's Samantha. I'm a nurse on the surgical floor.
Okay, and you're wondering if you can put Maxaran in normal saline?
Yeah.
Okay, it's all in the parental guide. I'm really busy right now. I don't have time for this.
Well, that was rude.
Well, you should have been listening and you should know this. It's in the manual. Sorry.
Hi, my name's Samantha. I'm a nurse on the surgical floor here. I was just calling to check on a med that my patient was prescribed. Do you have a moment to talk?
Yeah, I do. Go ahead.
So my patient was just prescribed Maxaran. It's supposed to run a normal saline, and then they've also been prescribed Lopressor and Dilaudid, and I'm just calling to make sure that I can administer all of those together.
Yeah, for sure, you can do it. And just for future references, you can look it up in the parental manual.
Oh, okay, perfect. Thank you very much for your time. Bye.
Oh, here, I'll show you where it is. You just go here.
Oh.
And then it shows you everything.
Oh,
It's just
perfect.
lined up.
Thank you. That's
Yeah,
so
no
nice.
worries.
Yeah.
Hi there.
Hi, I don't know what's going on with me.
Well, you have subacute thyroiditis, your TPO antibodies were high, your TSH levels were high as well, and just take one of these T4 pills every day, and now we're just going to use this sphygmomanometer.
Wait! Jargon alert!
What's jargon alert?
Patients don't always understand what medical terms we use are.
So, our role as a health professional to be client-centered is use friendly terms.
That makes sense.
Hey, let's try again.
Hi, how are you?
Hi, I don't know what's going on with me.
Well, you have subacute thyroiditis. And do you know what the thyroid is in
No.
your body? Well, the thyroid is almost like the accelerator of a car. So right now, yours is a little bit on overdrive. So what we're going to do with these pills that I'm going to give you is just bring it up a little bit. So that's why you've been losing weight and you've been feeling hot, just because it's been burning a little bit too much gas.
I get it now. With Mrs. Jones.
Doctor said Mrs. Jones can be discharged today.
So what should I tell her?
Just tell her doctor will take care of it.
Okay. Hi, Mrs. Jones. You're being discharged today.
Oh, okay. What about my medication? Do I get a
The
refill?
doctor will handle it.
Oh, and my
The
therapy?
doctor.
The doctor.
Hey, so what's going on with Mrs. Jones today?
She's being discharged today.
What should I tell her?
Probably bring up her OT in the community and the pharmacy.
Okay. All right. Hi, Mrs. Jones. We're going to discharge you today. Do you have any questions?
Yes, actually I do. What's going to happen with my medication? Am I off them? Am I going to get them refilled?
You're actually on some new medications, and we're going to consult with your local pharmacist to make sure they're up to date with your medications, how long you need to take them, how much you need to take.
Oh, perfect. And what about my therapy? Am I done? Am I going to continue? How does that work?
We're actually going to consult with your occupational therapist, and they'll contact you to make sure you're okay at home, you don't need additional aid or anything like that.
Perfect. Thank you.
And just to let you know, before your discharge, another nurse and a doctor is going to come in to teach you some precautions while you're at home, just to prevent any extra falls.
Oh, perfect. Thank you very much.
Welcome.
Hi, what brings you in today?
Oh, hi. My back just has been hurting really bad lately, and I just couldn't even go to work today.
Okay, well, I think the best option for you right now would be morphine, so I'm going to write you a prescription for that.
Morphine? I don't think I want morphine, because isn't that what people are addicted to on the street?
Some people are addicted to it, but I think for the point that you're at right now, this will be the best option.
I don't think I want to take morphine. I don't want to be addicted to any medication.
Okay, well, I'm gonna write this, you can give it a try. And I think really this will take away your pain and then you can go back to work and it'll help you. You're welcome. Hi, my name's Hillary. I'm the family physician at this clinic.
Hi, my name's Fiona. I'm the nurse.
Hi, nice to meet you guys too.
So what brings you today?
So my back has just been hurting really, really bad, and I just couldn't even go to work today.
Oh no, it's terrible.
Yeah, it's horrible.
So I think at this point, the best option for you right now might be morphine. How would you feel about that?
I don't want to take morphine. I don't want to be addicted to it. I don't want to be like one of those people on the street that constantly search for morphine.
Okay.
No, that's not what I want to do.
Definitely. We have some other options that might be of interest for you.
Yeah, I think a big thing for you would be just prevention. Don't do strenuous activities or put strain on your back at all. Lift heavy weights just to prevent the pain from actually flaring up or happening. Another option, if you'd like, we could refer you to a physiotherapist. He can even teach you some exercises or activities that would reduce the pain or prevent it when it does happen.
So I don't have to take any medications for that. Okay, I like that.
No, and if that doesn't work also, we can also try some other medications that will be less addictive, like some topical solutions or some other things that might work for you.
Oh, okay. I didn't know there were so many options.
Yeah, definitely. Which option would you like to try first?
I think I'm going to try the physio first just because I'm kind of against taking medications with all the side effects and everything.
For sure. Okay, so we'll refer you to a physiotherapist, and then how about a follow-up little meeting in 2 weeks to see how that's going?
Sure,
for you?
that sounds good.
Yeah, and then if that doesn't work out, we'll do some other options.
Okay, sounds good. Thank you guys so much.
Thank you. You'll be hearing from our physiotherapist very soon.
Okay, take care. See you.
She needs OT the most.
No, she doesn't! I don't know what you're talking about.
Okay, she needs her meds first.
She has
blood pressure.
Are you guys crazy? Are you?
A few moments later.
Maybe if she'd stop
Are you even paying attention?
Has anyone actually talked to this patient? What are you doing? This isn't home. I'm comfortable, okay?
Oh my gosh.
One eternity later.
Look at that. We ran out of time. We got nothing done.
Thanks for being on time today, everyone. We have 4 patients to talk about. Let's get started.
So I think last time, guys, we weren't very efficient in our time management and we weren't overly good at collaborating. So let's try and work on that a little bit more this time, and I'm sure we'll get a lot more done.
That's a great idea. So last time we didn't quite finish with Mrs. Jones. I'm really concerned with some of her medications because there seemed to be some drug interaction between them. So can we get started with that first?
Yeah, for sure.
1 hour later.
Just to let everybody know, we have 5 minutes left, so I think we should summarize.
To summarize, we talked about 5 different patients today, and we developed an efficient care plan for them.
So I think we did a lot better today, guys. I think we were more efficient and we collaborated better. I think we did a good job in getting a plan of care addressed for each patient, and we were better on our time management.
That was a great meeting, everyone. Let's go visit our patients and discuss again tomorrow morning.
I think some of the strengths of the Canadian healthcare system is that the system is set up to deal really well with acute injuries. We're up to date with a lot of our technologies and diagnostics. The Canadian healthcare system is fairly accessible, with doctors being found even in rural parts of Alberta. Some of the cons that I think is because our system is set up to deal mostly with acute injuries is we're really lacking a chronic care approach. With the aging Canadian population, this is going to become a bigger issue as they, continue to get older and require more collaboration between different health professionals to manage those chronic conditions. So there's going to require a lot more interdisciplinary care to manage these patients, as well as there's going to have to be an increase in communication between all the interdisciplinary groups to make sure that the patient receives the best care possible.
Oh, so what brings you to the clinic today?
It burns when I pee.
It burns when I pee.
What do you do for a living?
I'm a sex trade worker.
You should maybe get a less risky job.
Well, I can't really help that now, can I?
Can't do anything for you.
All right.
So what brings you to the clinic today?
It burns when I pee.
What do you do for work?
I'm a sex trade worker.
Okay, well, are you getting screened for STIs regularly?
Why, yes, I am.
Well, another thing you can do is actually just use condoms. That decreases the risk of catching an STI. Actually, we have a bowl full of them at the front, so on your way out, you can grab a couple.
Thanks, I've never thought of that.
In professional programs, healthcare students are becoming more aware of other professions' roles, so once in practice, they have the knowledge to refer to the appropriate person when needed.
Challenges to future interprofessional teamwork is that we're still in the transition phase because in the old school way of the healthcare system, everyone worked individually, and the new system, we start to work together.
Future IP teamwork will be evident in more primary care networks. These provide better care for patients as it's more holistic. You have more people caring for you that are experts in their own field. You have easier access to this care, and having more professionals dealing with the patients in their own respective expertise leads to better care and better patient outcomes.